You've elected to have hip replacement surgery. The goal of surgery is to help relieve your hip pain from your hip arthritis. You've tried to manage your pain with non-surgical treatments such as medications, physical therapy, injections, or even using a cane or walker. The pain is now to the point where it gets in the way of your everyday activities and your quality of life. The goal of hip replacement surgery is to relieve you of pain from your hip arthritis. As a result, you're able to do more, walk for longer periods of time more comfortably, and return to many of the activities that you enjoy doing. Surgery, though very successful, is not without risk. Before surgery, we do a preoperative assessment to make sure that all of your medical conditions are in good shape to minimize your risk of any problems during and after surgery. Prior to surgery, we will schedule an appointment for you to meet with our anesthesiology team. They will discuss with you a plan to keep you safe and comfortable during surgery. The risks of surgery fall into two major categories: medical and those related to the hip replacement itself. The medical risks include things such as heart attack, pneumonia, or stroke. Part of your pre-surgical evaluations help to minimize these risks. There is also a risk of blood clots that can go to your legs or to your lungs. We put you on a blood-thinning medicine to help prevent this from happening after surgery. Risks related to the hip replacement itself include infection of the hip replacement, dislocation, and leg length inequality. We do many things to help prevent these risks. For example, in order to minimize the risk of leg length inequality, we do planning prior to surgery to make sure that we accurately and successfully reconstruct your leg length. To reduce the risk of infection, we do lots of work before surgery, including making sure your dental work is up to date, making sure medical conditions are well optimized. We provide you with antibiotic ointments, antibacterial wipes, and even give you antibiotics during and after surgery to reduce the risk of infection of your hip replacement. Should you develop an infection of your hip replacement, it is a problem that often requires both surgical treatment as well as antibiotic treatment. It is a very serious problem, which is why we do so much to help prevent that risk prior to surgery. The risk of dislocation, similarly, is also very small. For the first 2 months after surgery, the risk is approximately 3%. Your physical therapists and I teach you a variety of things that you can do and not do in order to minimize this risk. Once you've healed from your hip replacement surgery, that risk reduces dramatically, and some of those precautions relax. Though there are risks associated with surgery, the goal is to relieve you of your pain, and many people are very, very satisfied with their outcome after hip replacement. Surgery itself takes about 1 to 2 hours, and you are typically in the hospital for 1 to 2 days after surgery. Once you've completed surgery and are transferred to your room, you'll be seen by the physical therapists who work with you to transfer in and out of bed, walk down the halls, and even walk the stairs. We make sure your pain is under control. We use a variety of pain medications to help give you good pain control while maintaining your alertness, minimizing the side effects of pain medication, and allowing you to participate in physical therapy comfortably. After surgery, you will either go home with home nursing services and home physical therapy, or to a nursing facility. This is the case for a very small number of patients. Most patients are most comfortable at home, and our support services allow you to be safe and comfortable in that setting. I will see you for your first post-operative appointment about 2 weeks after surgery, and you can always call the office with any questions or concerns.